Hi everyone, welcome to researchmd.com. We're going to teach you everything about cluster headache under 9 minutes. That's our goal. All these points will be covering cluster headache, everything you need to know. We have made a presentation of migraine headache before, so today's topic is cluster headache. Again, my name is Pramil Cheriyath. I'm a program director, internal medicine residency, transitional residency. I teach medical students and medical residents. So let's get into our topic today, cluster headache. Why is it always cluster headache is very, very important because of the unique treatment, the uniqueness of the pain. So if you're taking a test, always make sure you know cluster headache, okay? So let's get into our subject, characterized by attack, severe unilateral pain, maybe behind the eyes, ipsilateral, autonomic symptoms like there is like tears in the eye, clusters, that's the word you have to look for. It can last like 15 to 180 minutes, clusters of frequency, 0.5 to 8 headaches per day that typically lasts 1 week to 1 year, okay? So there's episodic cluster headache and there's a chronic cluster headache. Episodic greater than 2 cluster period lasting 7 days to 1 year, separated by pain-free period lasting greater than 1 month, and you got cluster attack occurring more than 1 year without remission or with remission lasting less than 1 month. It's good to know the episodic cluster headache and what is the chronic cluster headache, okay? Epidemiology, typical age onset, we need to know, and ages between 10 to 39 years, more common in men, okay? So if somebody asking question like a 49-year-old patient came with 49-year-old male patient come with a headache, if it is a question, think what? Cluster headache, okay? Because most of the headaches are like in female, cluster is very common. It's a very, very important point, okay? So risk factors, family history, general current first tobacco use, genetic variant, all of this will play. Pathophysiology is still not very clear. You got interaction of the trigeminal nerve with the trigeminal vascular system, parasympathetic nerves, and the hypothalamus involved. So you got the activation, trigeminal nucleus system produce pain symptoms. The activation of release calcitonin gene-related peptides, a cranial vessel, which potentiate the nociceptive signals and increase serum CGRP associated with it. And you got trigeminal nerve system innervate the trigemino-cervical complex in the brainstem, which also participate in the central pain processing. Here we already talked about parasympathetic system involved. That's like autonomic symptoms associated with the cluster headache. Then you got peripheral nervous system activation releases vasoactive intestinal polypeptide and pituitary adenyl cyclase activating peptide and serum levels which may increase during the attack. So a lot of reactions happening in the pathophysiology, okay? Then also you got hypothalamus involvement, such as a projection to the trigemino-cervical complex and superior salivary nucleus, and possible circadian pattern of cluster headache attack, okay? Potential role of hypothalamus, circadian pattern. So we talk about, parasympathetic system, think about it. Then you got hypothalamus involvement, and then you got the trigeminal involvement also. Signs and symptoms, we need to know that. Very characteristic, unilateral headache, sharp, piercing, throbbing, retroorbital or periorbital, okay? Attacks usually last 15 to 180 minutes. Pain in usually maximum intensity for duration of attack, then end abruptly. Pain behind the eye, like if somebody writing a question and said behind the eye there's a pain, always think about cluster. 88 to 92%, over the temple 69 to 70%, on the maxilla 50 to 53%, on the other areas of head and neck in some patients also. Okay, so other symptoms, episodic cluster headache typically occur in boots or cluster. Cluster is the word. Daily headache lasting 7 days to 1 year, followed by remission for like months to years, my friends. And then you got chronic cluster headache occurs as a cluster. Remember the word clusters, okay? Attack frequency during cluster varies once every other day to 8 times daily. Again, if we talk about the parasympathetic nervous system involvement, right? What are the signs? You got autonomic nervous system, autonomic symptoms, lacrimation, conjunctival ingestion, nasal congestion, ptosis, edema of the face, rhinorrhea, facial cell meiosis. All of this kind of very, very common. Triggers, many triggers. Alcohol, red wine, volatile odors, nitrate ingestion, glycerol trinucleate, sildenafil ingestion, weather changes, seasonal changes, bright light, flashing light, and even watching television. Diagnosis, so you have all these clinical symptoms. Suspect cluster headache in a patient who experienced bouts or clusters of severe unilateral headache. Again, the word is unilateral headache. Men, so all things. retroorbital boots of episodes. Okay, so you got nice classification from International Headache Society criteria. At least 5 attacks fulfilling criteria: B to D, severe or very severe unilateral orbital, supraorbital, or temporal pain, either in both of the following. There's conjunctival injection, nasal congestion, eyelid edema, forehead miosis, a sense of restlessness occurring with the frequency between 1 every other day, 8 per day. And now look at the imaging. Okay, all the other migraine, tension headache, you don't need to kind of worry about the imaging. But when you talk about cluster, there's a lot of reports about something kind of usually have like some kind of abnormality in the brain. So if you want to do a test, and if you're thinking about cluster headache, maybe you don't, I mean, you may want to do an MRI when somebody present with a cluster headache, okay? You're trying to rule out other causes of pituitary, carotid dissection, cavernous sinus pathology, management. You got sumatriptan 6 mg, subcutaneous injection, or 20 ml nasal spray. Solmitriptan is there. Other abortive medications include octreotide, subcutaneous injection, and lidocaine 10% nasal spray is used for prophylactic therapy. You got verapamil 360 mg daily, melatonin 10 mg orally, okay, very good drug. Lithium 900 mg. So complication, high frequency headache attack during a boot substantially reduces the quality of life, may lead to suicide also. So very, very painful condition, people can commit suicide. Cluster headache associated with psychiatric conditions such as depression, anxiety, and aggressive behavior. Thank you so much for watching our presentation. Please subscribe to our channel and click the like button. Thank you.